Welcome back. We're talking about jobs in public health and jobs in global health, and there's quite a lot we're going to talk about today. And in a few seconds' time, David Stuckler is going to join us as well. So he's just having a bit of technical problems. He'll be in just a second. There's a couple of things we're going to deal with in today's episode. Firstly, of course, this is live. So if you're watching this on LinkedIn or on YouTube or on Facebook, make comments. We will go through comments, respond to questions, etc., etc. So please do that. What I'm going to do, as well as respond to questions and thoughts and comments, is have a deep dive into an organization that you might be interested in working for who are currently advertising posts, and that is Unitaid. I used to work for Unitaid. I know them well. I love them to bits. They're a fantastic organization to work for. And I'm going to talk you through kind of a little bit about the organization. I'm also, and then just point you in the right direction with respect to how and where to apply. I'm also, and that's probably for people that have got a bit more experience in the public health space. I'm also going to give advice as to how people that are new, so you might have just finished your MPH and you're looking for entry-level positions, and there's some really interesting mechanisms, particularly hosted by the World Health Organization, that will give you a bit of a foot up, and I'm going to walk you through all of that in a couple of minutes. Now, I think David might be joining us. Let's just sort of see if he pops in here. Anyway, not yet, but I'm sure he'll be here in just a second. So, there's one more thing I want to tell you about. If you look on the screen at the top on the, it's your left, on top of the left, there's a QR code. That QR code, if you take your phone and scan in that QR code, it's going to take you to a web page. And I'm going to basically let you see that web page now. Let's have a look at that. It's going to take you through to this web page right there. Now you're going to be looking at it on your phone. This is a mechanism for you to upload your questions, video questions, right? So you can take a video on your phone, upload it via this website, which will be on your phone because you've now scanned it in. So maybe just take note of the URL or save it or something. In actual fact, once you're at that URL, you can do the recording straight from there. Send us your questions, not just questions, maybe comments, thoughts, something you'd like to see on the show. You might want to see us talk about a particular organization, or what you'd like us to talk about, a particular struggle that you're having with respect to, your CV or job applications, or how to put in, how to prepare for a job interview, etc., etc. So put in your questions, make them as specific as possible. And we will then, in these live shows, we'll bring that video up and let you ask the question, kind of on the show, and then we'll respond to it. So I hope that makes sense. That'll be quite a lot of fun. And I'm really, really looking forward to doing that. So please do go ahead and add your questions via video. Of course, the usual applies. You can ask questions in the chat, regardless of what platform you're on, and we'll bring those questions up onto the screen, and we'll be talking about them as we go. Now, I think David is here. I'm just going to bring him into the show.
Hey, Greg.
David, good to have you with us. How are you?
Doing well. Thanks for bearing with me. Some tech issues on my side. Good to see you as ever. Excited about the new questionnaire that we can field questions, and excited to join you.
Yeah, I like the idea of people sending in video questions and us bringing them in and letting them speak and be seen. And you know what? Even if, I'll tell you what, don't just send questions. If you've had a really positive experience in your search for a job, or a place that you've worked, and you want to just send a short video saying, hey, I worked at this place, it was fantastic, or I currently work at X place, fantastic place to work, really excited about it, send that. That's fantastic. We'll stick it in there. We can't promise to put everything in. We'll do what we can, but it's a fun little way of making this a bit more interactive and a bit more personal. So I'm excited about doing that.
Absolutely. It inspires the community. I think sometimes people are a little bit scared to brag, but this is one where it's those wins. You never know who might need to hear just that and might want to reach out to contact you and really tap the power of community so they can also benefit from the things that you've learned and led to your success. So yeah, share those wins with us.
Share the wins. Oh, and by the way, in the chat, I see a couple of people are doing it. Just also say hi and where you're from. That's quite nice as well. So if you just tell us where you're from, as well as the questions. We can't always get to all the questions, but we'll do as much as we can. While we're waiting for questions to kind of stream in there, I want to quickly talk about Unitaid, because Unitaid is currently advertising jobs. I think it's a fantastic place to work, and I'll tell you a little bit about what they do so that you know whether or not this is a good fit for you as a sort of a public health professional. Unitaid used to be part of the World Health Organization. And actually, when I worked for them, that was the deal. So I worked at the WHO as part of UNITAID, which was kind of a subsection of the WHO. They've subsequently kind of untangled themselves from the WHO, and they're their own organization, but they work very closely with the WHO and the Global Fund and a number of other organizations. Their remit is to impact market dynamics for products. It used to be just for HIV, TB, and malaria, but that's expanded substantially since then. And the projects they do are so unbelievably exciting and so impactful. And I'll tell you about one of them just so that you can get a sense of the kind of thing that you'd get involved with if you wanted to work at UNITAID. So a problem that they were trying to solve was pediatric antiretroviral drugs for children with HIV were prohibitively expensive for low and middle income countries. So countries couldn't afford them. And because the actual procurement of ARVs for kids in these countries was so low, the price of the drugs remained high because the drug companies were saying, well, look, there isn't the demand. We're not able to kind of move enough volume to justify bringing the price down. So what UNITAID did, they put aside about $500 million, and they worked with the Global Fund and with the Clinton Foundation, and they set up a pooled procurement mechanism whereby countries would, a number of countries using the UNITAID money and working with China, they would procure as a group. And this, in a very short space of time, in the space of about 5 years, this meant that the volume of procurement of pediatric ARVs went up substantially. It also translated into negotiating power. So now suddenly a whole lot of money is getting spent on these drugs, and you've suddenly got pharma at the table having a conversation about what do we need to do to bring the prices into a point that we could keep this market going. And it's just such a lovely example of a win-win situation. The price for treating kids went down from, I think it was like 900 odd down to less than 100 per child. It became completely affordable. And today, if you're a child in Africa with HIV, 100% you have access to ARVs, which are absolutely life-saving. And those kids can actually live, we think, a normal lifespan. So, that's the kind of project that UNITAID does. I love them to bits. They're advertising for jobs right now. So absolutely, if you're in that. And look, UNITAID hire people with all sorts of backgrounds. If you could have a legal background, you could have a public health background, you could be into supply chain and logistics. They do all sorts of things. So absolutely have a look at UNITAID. David, any thoughts about all of that?
Love it. I mean, global health is not your ticket to a boring life. And I think it makes such a difference which institution you're in. And many of you are going down this path because you want to work to bend the arc of history towards the greater public good. And it's just really inspiring to hear being on the inside of those big, powerful organizations, you can really amplify your impact in profound ways. And what a wonderful thing for those who are a part of that initiative. That's the stuff that you tell your grandkids about, that you feel proud of. And that's worth more in my mind than any salary or compensation package in a way. I strongly, you give me some career regret that I didn't go with UNITAID now.
Well, I absolutely loved it. Let's have a look. There's a couple of questions popping up, and I'm going to just have a look and see if there's any that we can bring. I'll just pop one or two on the screen, and we'll kind of read and respond to them as we can. So I'm from India.
There's a nice one here about Michigan asking about if their education could be a great fit. What do you think about that one? Do you see that one, Greg, right at the top, Morgan Jones?
Okay, I'll bring that in. That's a good. They will bring that one in next. That's a good one. Yeah.
Okay,
I'll just respond to this one about what are the current areas where opportunities are high. What skills are in demand? I think that's a good question. And I'd actually expand that question to not just where the opportunities are high now, but where do we think that there's going to be increasingly more opportunities for people in the public health space and the global health space to get involved? There's two that kind of jump off the page for me, and that is climate change and health and antimicrobial resistance. Like, these are just two issues that are not going to go away. The problem, if anything, is getting worse. The number of people that are going to need to be involved is just going to be scaled up. The other is, of course, pandemic preparedness, because we've just come through a pandemic. Everyone kind of got a bit hurt by COVID-19. and there was a sense of, well, we better get ready for the next pandemic. And there are worrying bugs flapping around that are keeping people that are in that space on their toes. So H5N1, that's bird flu. There's a lot of anxiety about the potential for a bird flu pandemic, and a lot of work is going into putting in place mechanisms to circumvent that, or to at least mitigate it, or have a robust response. But that costs money. It means resources are getting poured into it, which means that there are jobs available. In terms of the skills, I think there's a couple of things. I always feel as if you've got a strong background, if your epidemiology is strong, you can apply yourself into almost any area of public health, right? Because epidemiology is really, understanding the distribution and the cause of disease and states of well-being. And all of the issues that we're dealing with in some shape or form are really reflecting on the application of our understanding of epidemiology in the real world. So the so what factor, how do we apply that knowledge and information to public health programs, projects, and policy? So I always say, if there's nothing else that you're going to focus on, make sure that your epi is strong, and then everything else, absolutely other skills come to play. But that's kind of my thought about what's probably most important. Sorry, my daughter's just popped in. Sorry, Squeaky, I'm just on a call.
Absolutely. Well, Greg's on that. I'm just going to echo that vote for data. Being increasingly able to speak data leaves you feeling confident in whatever room, any context you might want to be in. And increasingly, that fluence with data is necessary to spot patterns, trends, engage in outbreaks, whether you're doing that as an epidemiologist or an economist. Getting that familiarity with data and data science also does translate. I personally went from doing more epidemiology into moving into more economics, and I was really thankful that I took that bitter tasting medicine of a lot of epi courses, which seemed boring, to do lots of biostats, and it's been one of the best investments I've made in myself that continues to pay dividends. So even if you're not doing the stats yourself, being able to be in a leadership role and feel like you have your feet when you have a team under you of highly trained data scientists will be indispensable. And like Greg says, recognizing that the winds are moving the currents that direction is, if you have the choice, many of you are investing in your training now, it's good to prepare yourself for that next generation. Greg's back with us now.
I'm back. My daughter desperately needed permission to use the iPad. So was that urgent? Everything had to stop. Thanks for that, David. So a question from Morgan from Michigan. You've got a master's in public administration and a certificate in public health. Would be able to apply for global health jobs. Is my education a great fit? The answer is you absolutely will find a place for yourself in the public health and the global health space, but you may need to shuffle around a little bit in terms of looking, you may need to shuffle through the various jobs that are being advertised. There are lots and lots of jobs in the global health space that don't require of you to have a master's in public health. Like there's lots of them. In fact, if you, once you start working in the global health and the public health space, you realize that there's a whole lot of people in that space that haven't come from a public health background, but are bringing a transferable skill into the mix. Okay, so absolutely, you're going to be eligible to apply for jobs. A lot of the jobs are advertised in a way that they sort of say, we want you to have a higher degree. In other words, they don't specify that it's necessarily a higher degree in public health. They just want you to have a higher degree and a certain amount of experience. And, and we can actually look at a couple of them in a couple of minutes. We might, in fact, why don't we do
Greg, I was going to suggest, suppose that, you're completely naive to this and you're just starting and thinking, well, maybe I do want to go to check out some global health jobs and see if that could be my ticket to changing the world. Where should somebody start?
Well, I'm going to quickly share my screen again.
Great.
And I'm going to just walk you through a couple of tabs here. Just a quick shout out to Johns Hopkins. They've got Global Health Now. It's a great online newsletter if you want global health news. I'm just putting it up there. It's got nothing to do with jobs, but everybody that's watching this is interested in public health and global health. I know the people that curate this. It's a lovely, lovely resource. So that's just a quick shout out to the Global Health Now team. This is my web page, just so that it's free. If you click on, you create an account for free, click on free resources, that's going to take you here. And here I've got a whole lot of free resources, some of which are about jobs. So you can click on a global health cheat sheet, and that'll give you links to organizations that that are advertising jobs at the moment. I just wanted to quickly highlight the CDC. I like the CDC career page because it's got this lovely pull down category menu. And this is what we're kind of alluding to. Look at these jobs here, right? This is civil engineers, computer engineering, computer science, data science, diagnostics. Okay, that's quite medical. Economics, electronic engineering. I mean, they employ people from every imaginable walk of life. And so if you find these drop-down menus, you can scroll through them. Public affairs, and you might find something that's a really good fit for you, even if you don't have a strong public health background. So definitely have a look at the CDC webpage. Now, the WHO careers webpage. Okay, first of all, it's a little bit difficult to find when you go to the WHO webpage. You've got to scroll all over the place. Go right to the bottom. There's a link that'll bring you here. So but you can also use the link from my webpage that'll take you here. I just want to point out one or two things that are quite interesting about this page. If you scroll down, there's this sort of apply now. And if you click on the apply now, that's going to take you to a similar sort of search engine where you can filter. And we'll have a look at that in just a second. But if you keep scrolling down, right, keep scrolling. And then once you're almost at the bottom, bam, right here, WHO talent programs. And this is fantastic for entry-level people. If you're looking for your sort of first job, or you're don't have those kind of 10 years of experience that's being asked for in many of the jobs that are advertised, come here. This is useful. And if you are kind of further on in your career, just focus and pay attention to this now, because people that are downstream from you are going to be asking you about this, and it's worth knowing. The WHO have got these entry-level streams, and each of them is slightly different. I mean, we won't talk about the volunteer program one. That's kind of, pretty obvious. There's the internship. Now, the question that people ask about the internship is it paid? And I looked into this a little bit this week. I understand that it's not strictly speaking paid, but you can apply to the WHO for financial support. So it doesn't come with a salary, but it comes with the option of applying for support, and the extent to which they support you will be a function of where it is that you are doing the internship and the cost of living, et cetera, et cetera. So there's a couple of factors. I don't have a lot of insight into that. I'll try and find out more about it, but they certainly aren't just leaving you high and dry. There is a mechanism whereby you can get something to help you stay alive. The two on the edges are interesting. The Junior Professional Officer Program, right? Now, firstly, I'll just tell you the eligibility criteria there. You have to have 2 years of experience, and you have to have a higher degree. So that's a master's degree and above to be eligible for that. The Junior Professional Program, they are very specific jobs that are advertised, and they are sponsored by member states. And usually the sponsoring member state requires that the applicant be a citizen of that country. And so if you clicked on that now, and I had a look at it, this afternoon, there's jobs that are being sponsored by Italy, but they require that the applicant be Italian. There's jobs and there's a couple of countries. I think there's a few from Germany, and there's not that many of them, but it's worth keeping an eye on. There may be a job, that's been sponsored by your country, in which case, happy days. And I remember when I worked at the WHO, I met lots of people that were there through those programs, and they went on to have fantastic careers. The Young Professional Program out on the right-hand side, that's a little different. Now, that's not sponsored by countries. Anyone can apply, except that you have to come from a least developed country. So this is a lovely way in for people that are from extremely poor backgrounds, poor countries. Again, the criteria is you need to have 2 years of experience and at least a master's degree. Okay, so there is sort of still a bar, but it is a way in. So I just wanted to point these things out, because people really don't know about them, and it's a lovely opportunity. If on the same page you click on the apply now, I'm just going to take you straight there. It takes you to the WHO. This is a little search engine, and I've shown people this before. It's quite nice because you can kind of sort things by what you're looking for. If you're from a health background, what I would do is I would tick this box over here, professional, because otherwise it's not going to filter by sort of public health jobs. It's going to have all sorts of administrative jobs, and there's a whole lot of jobs the WHO hire a lot of people that aren't really focused on public health programs per se. It's a big organization. It's got human resources and finance and all sorts of nuts and bolts. So you'd want to click on the professional box, and that'll filter things down to. And what's quite nice is they've got consultancy, so that this box over there, and then there's fixed term, short term. You can look at all of those things there. I wanted to look at a specific job. So here's a technical officer in primary healthcare, a P3 job. So this is going to be reasonably well paid. Now, if you look at a job description like this, what I would do first and foremost is scroll all the way down to the required qualifications. Check that you tick these boxes before you start reading the rest of the job, the terms of reference, because if you don't tick these boxes completely, you're not in the game. And I've said this before, in this case, it says you need at least 5 years of experience. If you've got 4 years, like 11 months, 2 weeks, you're not a P3 job. I think it's usually the case that they require a master's degree. In this case, no, they say a bachelor degree in medicine or any other health fields from an accredited organization. So that's interesting. That's essential. But then they've got desirable and advanced degree, a master's level or above. And because so many people apply for these jobs, it's my opinion that if you don't meet this desirable criteria, you're probably not really going to be. You might be eligible to apply, but you won't necessarily be competitive enough to get the job. So that's just an example of a job that's currently being advertised. This is live at the moment. So if people have seen this, they're interested in applying. I popped in here Unitaid. These are the live jobs that are available at Unitaid at the moment. I won't go through them now for time reasons, but I did want to point out the Gates Foundation also have kind of quite a nice job category, and they just only list the jobs that are currently live. So you can look at different job categories that may be of interest to yourselves. You know what I was thinking of doing? Sorry, David,
I wanted to highlight two other portals. Again, some of these are not exhaustive. The Geneva Center holds a global health platform that tries to curate a list of jobs around Geneva that are relevant to global health from different organizations. Check that out. There's a new site that I haven't used widely, just globalhealthjobs.com, which again, these are not exhaustive lists, but worth doing some sub searches around the categories and paying really close attention, like Greg says, to eligibility, because these organizations tend to be extremely strict with those criteria, especially the UN ones. So I'm glad you mentioned that, Greg.
Another good page is reliefweb.org. So if you are interested in sort of humanitarian work and you're one of the sort of MSF crowd that like to parachute into the sort of disaster areas and, help people that are in absolute crisis, reliefweb.org, they really have a very well curated page, and you can search through it and find things that might be of interest to you. There was a stage in my life when that kind of work appealed. Can't do that sort of work anymore now, but I used to go to reliefweb quite a lot. Something I was going to suggest, I'm going to make a suggestion, David, and I hope I'm not putting you on the spot. I wanted to talk to you about this before the show, but we had technical troubles. Last week we were looking at the possibility, how it is that you can use a clever prompt in ChatGPT to look at a number of jobs on your behalf, map it out against your CV, and tell you which of them you are most eligible to apply. I realize that not everyone is comfortable with creating a good prompt in ChatGPT. So what I'm going to suggest, David, is why don't you and I build inside ChatGPT a job search specific app, and we'll in either next week or sometime we'll tell people more about it. But it'll do pretty much what I showed people last week. You'll be able to drop your CV in there. You'll be able to cut and paste the URLs or the PDFs of jobs that you're interested in, and it will give you a summary of which of them you're most eligible for and why. And I think that's kind of, that heavy lifting. If you can just get that behind you and focus your energy on the jobs that you're most eligible for, you're going to save a lot of time, and I think you'll do a much better job of putting an application in place for those particular jobs. So, David, are you?
Hey, I'm in. I think it's a fantastic idea, and it's a tool I wish I would have had because it would save so much time. And excited to help you develop that.
Yeah, no, I'm excited about it too. I'm just looking at the questions over here. And I'm just going to pop one. I haven't read this question. I just saw the word MBA,
Yeah.
and I'm throwing it out there because
This we get a lot though. Some doctors who are transitioning, people are trying to make these career transitions. Greg, what advice do you have for them?
It can be difficult. I've always said there's two things. What I've noticed people do in the sort of public health and the global health space is either really get deep technical expertise and skills and knowledge in a particular space, and that you land up being indispensable in that space, right? So let's say, for example, you become kind of a real guru in the space of tuberculosis. You dig deep, you understand, the diagnostics, treatment, et cetera, the epidemiology of TB. You land up with a whole lot of opportunities in that space because you bring this wealth of knowledge into the conversation. It does, however, box you into TB. Not necessarily, and some people do kind of make changes. And a good friend of mine recently made a big change from HIV across to climate change. It's not impossible, but for the most part, people kind of can get stuck in a stream. But that's fine if it's something you love. So happy days. And I think when people do that, they find it easier to progress. The other route is to be a generalist, right? To have general transferable skills that you can apply to almost any area. That's kind of what I did in my career. I've enjoyed it because I've landed up doing multiple different things, but it does make career progression sometimes a little bit prickly, because so this person's asking about an MBA. I did an MBA, and I'll tell you what, I have found my MBA absolutely indispensable. What I learned in the MBA, I apply and use in my day-to-day work all of the time. It hasn't ever helped me get a job because the people that I'm applying to and I'm being interviewed by typically mostly haven't got MBAs, and they don't necessarily see the value proposition of having that skill set, which is a little bit unfortunate because I really think having an MBA in the public health space, I have found it tremendously useful. Having said that, so we've got Julius from Zambia, medical doctor with an MBA. I think that's a good combination. So double thumbs up, high five, Julius. He's in healthcare management. So you're already getting the kind of requisite experience that I think makes you interesting in the public health space, certainly. Between MPH and a master's in global health, which is a good fit for a career in global health, I think it doesn't really matter. If you did an MPH or a master's in global health, you're going to learn a very similar set of skills, and it's going to revolve around epidemiology. When they're applied in the global health space, you're going to get a little bit more nuance, where they're going to talk about the application of these ideas in very specific settings, and transnational settings, and low and middle income countries. I get all of that, but if you did an MPH, a master's in public health, you would still be very eligible to work in the global health space. If you wanted to, and you would, wherever you landed, just need to spend a bit of time digging deep and getting that additional knowledge, that you might have gotten from a master's in global health. But I don't think it matters terribly much, to be perfectly honest. Any thoughts from yourself, Dave?
Yeah, one thing I just always recommend is find somebody who has made that transition. You can reverse engineer people's career paths, often from their CVs or bios, and somebody who's already trodden that path is often more than you'd be surprised how willing they are to share their insights, what they've learned, what they failed from. Just a gentle flatter with some of these folks can go a long way to get their support. I do know when people come ask me for mentorship, my doors is often open. If people come to me, showing me that they've done their homework, they know why I would be a good mentor, they know what they're asking me for, instead of just dropping a kind of a hot mess on my desk. And this often comes through networks as well. So I did my master's in public health at Yale. We have an alumni network, and often they do the curating already, where whoever's in their career development side helps steer the right people to the right people, playing those broker facilitating roles, so that when students do contact me through that channel, we already have some rapport, and I'm more happy and willing to give them good support. But I strongly suggest, if you are making that career transition, find somebody who's effectively implemented it and learn from them, even reach out to them.
Okay, now this next one isn't a question per se, or maybe there'll be more because he's got ... at the end. A couple of reasons I popped this up. From Pretoria, South Africa. I'm a South African, so Joyce, high five, double thumbs up. Nice to see South Africans logging on. Good to see. The other thing that's interesting here is Joyce is a PhD student, and tobacco control, super duper. It's a super important area. the PhD student thing jumped out at me. David, you provide enormous support to people that are doing PhDs and doing research. Do you want to just talk about that? Because I know if I was doing a PhD now, I would be knocking on your door immediately saying, please help, I need mentorship. What do I do next?
Absolutely. I actually think Joyce is one of my subscribers. Joyce, good to have
Okay,
you
good.
join us. And if you do want to be in closer touch, I have a Facebook group where we can directly communicate there. Let me know. But yeah, Greg, I just saw a lot of students, especially in developing countries, just weren't getting the support that they needed to truly thrive. And when I looked across as a professor, I found the students who were doing well, it really didn't have to do with how talented they were, how smart they were, even how hard they were willing to work, but their ability to get the right support in training. And you think this would be on a silver platter in a lot of universities, but not everybody is blessed with the most amazing supervisor or mentor or support structure. So created open access resource at Fast Track Grad that shares a lot of soft skills around how to write, how to read scientific papers, all the way through step-by-step courses on systematic reviews, on quantitative analysis to help you go from start to finish to publishing your first paper. And our students get amazing results. And yeah, as Joyce is commenting here, thank you for preparing for the mentorship. Really appreciate the members, are really proud of the community. And you see here too, Greg, just what the power of a truly international community can be. I think so many people out there are just feeling isolated in this digital age. They're not really connected, and they're trying to navigate a complex journey like breaking into global health by themselves. And it doesn't have to be that way. I know, Greg, you've also got a powerful community that I would encourage anybody who's thinking about getting serious about global health going in and checking out right away.
Yeah. Very good. And so I encourage anybody, if you're doing research, tap into David as a resource. I don't think there's anyone better. Honestly, I don't know of anyone else that's providing anything commensurate with what you do in terms of really hands-on, at the coalface support for people that are doing this very, very, I mean, research is not a funny joke. It's very, having done some in my life, I know how hard it can be. Anna, a master's student in global health, public health. How can I build my way towards health consulting? So I've done a bit of the consulting, some consulting gigs, and I'll give you the good, the bad, the ugly. I know, David, you've done some as well, so you can jump in as well. But consulting work, I think, is really nice. It's kind of, firstly, it gives you a lot of freedom and flexibility. So you can work when you want, where you want. You can not work for a while. You can dip in and out. So it's really nice in that sense. It also pays quite well. So that's quite nice. In terms of how it pays you, I just want to kind of give a couple of caveats there. On paper, it really looks good, but keep in mind you need to pay tax on that. So, kind of cut everything in half if you must or whatever, but just make that calculation in your mind, because come year end, you do need to pay tax. And often if you're, well, I'm speaking from experience, you kind of forget that actually not all of that is your money, firstly. Secondly, you need to build in to the fact that if you're going to be doing full-time consulting, you need to spend a certain amount of time chasing up clients, finding the work, putting in applications to do consulting work, meeting with potential clients. Once you've done the work, invoicing them, getting them. There's quite a lot of background messing about, and that takes up time, and that's time that you're not being paid for. And I would say you probably need to sort of say, carve out maybe 25% of your time to be doing all of that. And in the first instance, probably more than 25% of the time. Because at first, you don't have any clients, right? You've got to find them. You've got to get on calls. You've got to speak to them. You're not getting paid for any of that time. Down the line, you might find that you're getting more opportunities to do work than you've got time for. And that kind of, probably at that point, you're probably talking about doing 25% of your time being spent not being paid for. So keep that in the calculus when you're working out what you think you're going to earn. But having said all of that, it's really nice work. I will also just say one more thing, and then David, you can jump right in. Consulting work, it's two things. Firstly, it's a great stepping stone into an organization, right? So, and I know so many people that got great jobs in organizations because they started off doing consulting work and they became indispensable. And they got to know the people. They knew the organization knew them. They were, it is such a nice stepping stone into an organization. I highly recommend it as a career step if you're struggling otherwise. I will also say this, just to kind of give a balanced view of consulting work. you're moving from one project to another, and whenever you move into the new project, you're starting from scratch. You've got to get yourself up to speed, sometimes on a whole new subject matter in a very short space of time, and that's kind of exhausting. And then that project ends, and you move on to another project, and you're literally starting again from scratch. Got to get to know a whole new set of stakeholders. Sometimes, in terms of technical knowledge, you've got to get yourself up to speed on a whole lot of new stuff. It can be exhausting. You don't ever coast. And because they're paying you as a consultant, they're expecting you to deliver, and it can be exhausting. Having said that, I loved it. It's a really, and especially if you don't have a job and you're looking for a way to build up experience so to become eligible for other jobs, like double thumbs up. I highly recommend people look at consulting as an excellent option. But David, I know you've done some consulting work.
Yeah, so I think because Anna, you mentioned that you're a master's student. I think here you're likely in a position where you have a whole lot of energy and enthusiasm, but not a lot of experience. So at the stage where you are in your career right now, in a way you want to think about, well, how can I kind of trade my energy for that experience? And the consulting that you'll have options are often there are project-based calls for consultants. And they're going to be competing with lots of organizations who are going to put in bids to win projects. Those are going to be quite tough to get. And others are going to be looking for an individual consultant. That's all. You'd have a better chance there, but it's also going to be quite tough to get because you're going to have a competition from people who are just serial consultants and mopping these up. So I recommend you put yourself in a team context. Trade that energy for experience and find a team that has a track record of winning consulting projects and jump on one of theirs. That in turn is then going to put you in a position to help you win more of those consulting-based projects where they're looking for a consultant, maybe to go to Fiji or be on site somewhere in a country as a consultant. That would be the direction of travel, I would say. In general, consulting is a great kind of, say, even as a side hustle. I know many professors who do consulting a few weeks out of the year, and they say that's how they make their money. And they also do some work that has direct impact with organizations. They kind of cherry pick just the projects that they find interesting, and they do it out of desire, not out of necessity. And I think being able to have that choice in consulting, rather than living in constant precariousness about when the next consulting project might come in, is a nice way to think about it.
Yeah, and just a reminder to people that have joined in more recently and didn't hear us talking in earlier on, if you scan in using your phone, the QR code that's on the screen kind of over there, that'll take you to a web page on your phone that you can use to send us video messages that we will bring into the show. So we will literally kind of bring that video into the show. It could be a question, it could be your experience in a particular job, anything you want. I mean, if you think you want to say something on the show, send it to us. We're going to do this regularly, and we'll try to bring them in, and it'll be quite a lot of fun. I think it's quite a nice way to interact. So use your phone, scan in that QR code, and send us your video of what you think, and we'll stick it in the show. I just put on the screen there another comment from Joyce. Is project management a great add-on? The short answer is absolutely. Almost anything you're doing is some kind of project, and project management skills are absolute gold. So bring it. Absolutely. Highly recommended. Daniel from Ethiopia. I do have a master's in public health epidemiology and a bachelor's degree in public health. What kind of skills do I need to become a competitive epidemiologist? You've got a master's, so you've got the background education. So boom shakalaka, that's half the battle. What you need is experience. I understand that it's the case that people say, how do I get the experience if I can't get a job to get the experience? That's, we talk about that all the time, but it is an ongoing problem. But you've specifically asked about skills, and that's quite an interesting question. I would say in the area of, epidemiology, a skill that may make you stand out is strong data visualization skills. And data viz, I think, is becoming more and more sophisticated. And the value of data visualization is just becoming so obvious. It's no longer the case that we just draw a bar chart. I mean, there's nothing wrong with that, but like seriously, there are so many exciting ways to take complicated epidemiological data and package it in a way that it's easy to digest by an audience who are very often not epidemiologically literate, right? So you want what you're saying to be obvious to a policymaker who's got no background in stats and epi. Good data viz is a skill. The nice thing about good data viz is somebody that sees it immediately knows that you've done something interesting. Whereas if you've got, sort of deep skills in other areas, which there's nothing wrong with that, but it's a slightly more difficult sell. So your question was specifically to make you competitive. I would say data viz is a lovely add-on to your existing skill, which is in epidemiology. Any thoughts on that, David?
I mean, before I was giving my plug for investing in data science, data training, data visualization is part and parcel of that. It's one way within the data science community to really set yourself apart. I think a lot of people are investing a lot in some fancy machine learning algorithms and AI tools, which is well and good, but you still need to be able to have the ability to communicate and speak data effectively to others. And visualization is a way to do that. Yeah, I just 100% agree. I also got to give a plug to you, Greg. In R, some of your R visualization courses are first rate, and I recommend all my students who want to get familiar with R very quickly to invest their time and energy into those courses because it will give you that kind of unfair advantage over your competition.
Yeah, R is amazing in terms of data viz. It really, it's an exciting book. There's a lovely every Tuesday there's a little sort of global contest called Tidy Tuesday, and people all over the world sort of do data viz and compete against this on the same data set. So anyway, if you're interested, Tidy Tuesday, check it out. It's really nice. And as David said, I've got courses on R programming and data viz. You're welcome to have a look at those. Maria, is there an age limit to finding a public health job without or minor experience? There's no age limit. I'll tell you why. You're going to be bringing, and I'm assuming that you've basically been doing something else with your life and you're wanting to cut across into public health. And the trick here is to identify the transferable skills. What are the things that you've been doing, or the skills that you have, and how are you going to apply those in the public health space? Remember, not everything about public health is biomedical. There's a lot of practical stuff that needs to be done. A lot of the people I've worked with in the public health space had a background in banking, had a background in logistics, had a background in procurement and shipping. I mean, when I was working for Unitaid and for the Clinton Foundation, like what we needed to do was to get drugs into the clinics. And so we needed people that knew about how to do pool procurement, demand quantification, shipping, warehousing, distribution, inventory management. None of these are public health skills, but all of them were absolutely necessary to ensure that people got treatment. And so, yeah, a lot of public health actually leans on skill sets that come from all over the shop. And so whatever age you are, I have no doubt that you've got something valuable to bring. It might be a little bit more difficult to kind of find the right slot, but there's something out there. And, keep coming back. I mean, we want to have these conversations. So that's an interesting question.
Let me jump in because it's slight comment, I slightly disagree, but this could also be because I know Maria, Greg. Maria's a doctor working in Greece, and I find at the entry-level position, there can sometimes be a little bit of ageism. And so somebody with Maria with a lot of experience as a medical doctor, I find it can be kind of hard to transition to an entry-level post where you're competing with people, say, fresh out of graduate school or a PhD, who have maybe come through the internship trajectories that kind of have pathways that might not be accessible to you in the same way because you're not going through an internship track. So in a way, somebody with your kind of experience, Maria, I think you need to pitch even at a little bit of a higher level. Because you do tick the boxes of those. It requires a minimum of 5 years experience. You likely already have that. So do make sure when you're doing this, also make sure you're not underselling yourself. I do sometimes see people make the opposite of they're being overqualified sometimes for positions they're going for when they're transitioning.
Yeah, I think that's a good point, David. Absolutely. This was an interesting question, and there's a couple of things that jump off the page here for me. Firstly, we haven't talked about AI, really. I mean, we've talked about it in terms of how to get ChatGPT to kind of help you search for your jobs. But really, the future of AI and its application in the medical and public health world, I think, is super exciting, super interesting, and there's going to be so much movement in this space. So we were talking about like what are the trajectories and where the future careers, a good solid understanding of AI and people with skills in that space coming across and helping us in public health kind of apply that technology to solve the problems we're trying to solve. Absolutely. I think that's going to be very exciting. And for that reason, I think arguably the answer to your question is no. And so for those with an AI data visualization roles, is a portfolio in epi and biostats projects necessary? Of course it would help, but I really think that if you've got strong skills in that space and you've got an interest in coming across and working in the global health space or public health space, you will be welcomed with open arms.
Absolutely.
You can get up to speed on the epi and the biostats and the public health stuff. Don't worry, we will get you up to speed. That's the easy part. What you've done is you've learned something that's impossible for us to learn. Like I will never really completely know and understand, machine learning and, deep learning and all of these, that is beyond me. I can get you up to speed on TB treatment, half an hour, boom shakalaka, So, I think don't worry about the fact that you don't have a biostats and epi portfolio. You're fine. You'll be welcomed with open arms. I really believe it. Okay, just looking for other questions. There's quite a few questions, and I am sorry if I'm not getting everybody's questions answered. Again, remember.
By the way, just on a little plug, we are putting together a report on how AI can better inform and be used at elements of pandemic preparedness. If somebody is interested, we sometimes have projects. It's not quite consulting, but if somebody is interested to get involved on some research projects, every now and then those opportunities come along, and that is with WHO. So drop me a line if you're interested in getting engaged in that AI project itself. WHO is still kind of forward-looking and trying to figure out how to prepare themselves for this AI revolution that we're in the middle of. This is a great one that you've highlighted here, Greg. I'm glad you pulled that up.
Yeah, it's so many people struggle with this.
Yeah.
Look, and we've all been there. I think you apply for the WHO to the WHO and other big organizations like that, and it doesn't seem to go anywhere. This is why I was so excited about the question about consulting work and doing consulting work and getting your foot in the door sort of in a different way. Because what happens so often is the job that's being advertised already has an incumbent. And that incumbent is very often a consultant that got brought in to do the job. They now want to turn that person into a permanent staff member or give them a fixed term contract. They can't just give them the contract. So they have to advertise it. In theory, it should be a fair and competitive a job process where you've got as much chance of getting the job as them. But the truth is, and this is just human nature, this isn't how the world should work. This is just but the person that's been doing the job and sitting in the desk and knows everybody that's in the space and has maybe been doing it for years is substantially more likely to get it. And so often very good candidates from the outside are basically not in the running. And the problem with the WHO is this: you don't know which of the jobs that are advertised have an incumbent and which of them don't. And that's very frustrating because when I worked at the WHO, I met so many people who got the jobs that they did having first worked as a consultant there. And I was one of them. I worked at the WHO as a consultant, and then, being physically there, I think I was able to kind of translate that into eventually applying for and accepting a job at the WHO. So I empathize with the frustration chain.
Greg, I have people come to me and say, I've gotten so many rejections. What did I do wrong? I look at the application. In some cases, nothing. It's just hard to break in, especially if many, I would go so far as to say 7 out of 10 are already decided. And they're just using the interviews as a veneer of fairness. And frankly, I find that even more unfair.
I
People
agree.
who get their hopes up think they have a chance, and they were.
I agree.
And they from the beginning.
They're losing good candidates. Now, the World Bank, which, by the way, the World Bank is another great place to look to for global health and public health jobs. They do a lot of good work. The World Bank do indicate whether or not there's an incumbent or not. And I think everyone should do that. So
I didn't know that. That's much better.
Well, they certainly used to. Maybe they don't anymore. But like, I remember when I was looking around at the World Bank, they did, and I thought that that's really transparent, and I think that that's the right thing to do. Like, if there's an incumbent, say so, and then a person may still decide to throw their hat in the ring. Nothing wrong with that, but at least you know kind of what you're doing.
The other clue that can happen that they have somebody specific they want is that they write the call for the position in such a narrow way that hardly anyone can fulfill it, except maybe the one person they want.
Yeah,
this can that'd be another kind of sign reading between the lines that
you sometimes read a job description and it's so specific that you kind of think, well, that they've got they're just short of putting the person's name at the top of the page, like they've basically decided.
It's like, I'm looking for a South African who has worked in Ireland for several years.
Exactly. I don't know who we can find.
A young daughter.
Yeah, exactly. Exactly. I'm just scrolling through the questions quickly just to see if there's another good one to bring up. But I think we're probably almost out of time.
This is good. I can see on the submissions, Greg, I've been kind of in the background looking if people are successfully submitting, and we do have some video submissions. We are going to, Greg and I are going to look through all of these. We can't guarantee that we'll play everyone's, but it really enables you to have that kind of thicker, richer engagement with us. So thanks for sharing that. And some of you, because we also will get your email addresses from that, we may follow up and even invite you to join us on the program.
100%.
So we can extend the conversation.
Yeah, I think that's a great idea. And, we've put the page together for you to submit video questions, but I think submit anything. If we can't use it, we won't, blah, blah, blah. It just takes you 5 minutes, submit it. Especially if you've worked in a place and had a really positive experience. I love that stuff. When I talk about how much I loved working at Unitate and loved working at Chai, I hope that it inspires other people to go and look at those organizations, because I had such a positive experience. So if you have, or you are working somewhere that you think is amazing, send us a video. I think that's a lovely thing. We'll stick that up as well, and we'll give a shout out to places like that.
I get some weird ones in mine and my Fast Track Facebook group. I had somebody submit a llama the other day, but I was kind of glad they did because it was just kind of the thing that people in the group needed to see that day. So if you want to send us a video of your favorite pet, that's okay.
Oh, that's okay too. Excellent. So listen, I'm sorry if we didn't get to the questions that you put into the chat. What I might try and do is, I know some of them are on LinkedIn and YouTube, and we do see the comments there, and I might try and go retrospectively and sort of see what we can answer outside of the call. But I think, David, thanks so much. Like, always good to chat to you. I always learn a lot from you. You're a lot of fun. David and myself have never met in person, so
it's gonna happen. We're gonna have that epic squash match.
Yes, exactly. Yeah. We both play squash, and I'm a little nervous about the squash game because I think you're quite a hardcore player, David. But listen, thanks everyone for watching. Remember, you're watching this on David and my YouTube channels potentially. So if you're on my YouTube channel and you subscribe to it, go and check out David's, and vice versa.
Guys, if you're interested in global health, Greg is the man.
Okay, don't ever change. Don't do drugs. Always do your best.